Hi guys, I'm Dr. Lipnitsky, and today we're going to be talking about the shoulder. It's a very interesting joint altogether, one of the most complicated and complex joints, but we love treating this joint. I spent many years researching, studying this shoulder joint inside out. I think right now we have the most amazing program that we have put together to target some of the most challenging problems associated with shoulder. Most of the problems that are associated with the shoulder joints are chronic. They are repetitive shoulder injuries in nature, impingement, bursitis, problems with the tendon, whether it's an inflammation of the tendon or fibrosis of the tendon, tendinosis, often called by doctors. Frozen shoulder. All these problems are most of the time come about as a repetitive shoulder injury or some sort of other disbalances in our bodies. So we're going to try to cover most of them and just give you a good insight of what REBALANCE does when we're dealing with the chronic shoulder problems, chronic shoulder pains, or even something as difficult as frozen shoulder. So stay tuned, let's go over the questions. Dry needling, great tool in combination with other modalities. It has a very interesting, very unique action and benefit in the treatment of frozen shoulder in particular, but other shoulder dysfunctions in general. Have very interesting, very specific effects on the shoulder that cannot be gained by some of the other modalities. Therefore, I use it not only in a combination with other modalities for frozen shoulder treatment, but also utilize dry needling for treatment of many other repetitive injury syndromes, not only for shoulder joints, but for other joints as well. Well, let's talk about SHOCKWAVE. SHOCKWAVE is one of my favorite treatments, not only to treat frozen shoulder, but to treat many other conditions associated with repetitive injuries. There are not many tools out there that can do what SHOCKWAVE does, to break all this scar tissue and at the same time to stimulate the production of a new cell. This is very powerful and very incredible. TRIGENICS, truly very unique manual therapy technique. Unfortunately, it's still not practiced by many physicians or therapists, but it's truly gaining popularity, especially in treatment of chronic conditions like frozen shoulder. It's quite physical work to perform TRIGENICS, but the results and how fast you see those results are quite impressive. Sometimes we can regain the mobility in a joint that haven't been moving for months, sometimes years, in a matter of days using TRIGENICS. Diet and nutrition can play a very crucial role in the recovery process of problems like frozen shoulder and some of the other shoulder-related conditions. In particular with the frozen shoulder, type 1 or spontaneous frozen shoulder, most commonly linked with hormonal imbalances as well as autoimmune problems. In conclusion, proper supplementation, diet and nutrition, as well as some of the customized IV drips can be a great benefit not only in stimulating and promoting the healing, but also in preventing some of the recurrences of this terrible condition.